Well, the fellowship program is set up in such a way that the first year is completely focused on learning clinical rheumatology, and there are 3 rotations.
We've been involved very early on. For the last 5 years, we've had a full immersion ultrasound program. So our fellows, literally their first week of training, are starting to learn diagnostic ultrasonography. We see approximately 13,000 patients a year in a very diverse range of location.
Well, I think that we have a really extraordinary patient population in a couple of respects. The patients here in Barnes-Jewish Hospital are going to be everything that you read about in a rheumatology textbook. The patients at the VA are a little bit more what I call bread and butter rheumatology. So there's a nice balance. The fellow spends basically an equal amount of time in the tertiary academic hospital setting and in the VA hospital setting where more common things are seen.
The fellow clinic's my favorite place to be because no matter how crazy it gets, within a 3 or 4 hour span, you've seen so much and you learn so much. You learn from the fellows, you learn from the patients every day, every single day.
There are not very many places where you can go and not only see rare diseases, but have opportunities to work with colleagues in other specialties to really enhance the patient's treatment plan. I think generally the people who go through the program have seen pretty much everything. We're pretty close anyway, and so I think they're really well equipped as clinicians.
They're trained by outstanding clinicians who can teach them how to be clinical rheumatologists, but at the same time, trainees are exposed to cutting-edge research that takes place both within our division as well as within the university.
The faculty are approachable, they can call us anytime, and you don't get that sense in many other places.
My job is to try to teach you to think like a rheumatologist. When you encounter difficult situations, it really trains you to find a way to work through these because there often isn't an obvious answer and there often isn't somebody next to you who can ask.
To be a rheumatologist and be able to manage those diseases, you have to be like an artist because there is no right or wrong answer for each patient. Even though a lot of patients have the same disease, the way you manage them, it's going to be different.
The Washington University Rheumatology Fellowship really fosters whatever your goal is to become.
I wish I'd done my fellowship here. If I had it to do all over again, I'd do my fellowship here right now.